right, welcome to the program. This particular part is the health and lifestyle segment coming to you every Wednesday. We talk about wellness. We talk about just taking better care of ourselves, the children we have, the society, different conditions, how to manage them. And we are so glad that you created time for us this particular Wednesday, as we want to talk about something very interesting. We all know that we all aspire to have our children achieve the best learning outcomes in school. And of course, we want to understand something that usually would become a challenge, especially when a child is growing up, and that is what the experts will tell me, whether it falls under the category of disability, it's a disorder, what exactly it is, how it presents. I'm talking about dyslexia. And of course, maybe you have interacted with this word, maybe you haven't, but your child could be showing symptoms that we are going to be discussing right here on this, sit down, and you can be able to know what is the next step to take when it comes to supporting your child. But the thing is, it's nothing to worry about. There's a lot that has been done out there that can help your child to achieve better learning outcomes, whether or not they have been diagnosed with dyslexia. And of course, I have a panel with me. One has a very personal story to this. One is an advocate and is doing a lot to really just create awareness and help parents and caregivers navigate. And I'm talking about none other than sitting on my far left. We have we have Esther Wamai. She's an inclusive education expert and also a dyslexia consultant. Thank you so much for creating time.
Thank you very much.
All right.
And I'm glad to be here.
Karibu sana. And we have with us Patrick Munoru. Patrick is a parent, and for him, he knows this story too well. And he will be telling us what he knew then and what he knows now, and what he has done to support. Is it son or daughter?
My son.
Son.
Yeah.
How old?
He's 12.
12.
Yes.
All right. So karibu sana once again, and we really appreciate your time and company right here on the health segment. So maybe to begin with you, Esther, we are talking about dyslexia, and many would struggle to really place it, whether it's a disability, whether it's a challenge, just to sort of like explain to us what it is, so that we know exactly what we are dealing with and what we are discussing this morning.
All right. Yeah, thank you very much. And yeah, you're right. There's always that confusion whether dyslexia fits in the category of disability or disorder, but it's indeed a disability, what we call a learning disability, and under different categorization of disabilities. Even in manual we call a disability statistical manual, and that's the manual that gives guidelines on conditions that are categorized as disabilities. So dyslexia is under learning disabilities, and specifically what we call specific learning disabilities, because learning disability is an umbrella term. Then we have the specific, depending on what it affects. So dyslexia is indeed a disability, a learning disability, but the confusion comes because it's what we call an invisible disability. You cannot see it. There are no physical manifestations. You cannot tell. And we may be walking around with dyslexia, but nobody will tell physically until now somebody is presented with a book to either read, write, and that's when now it manifests itself. All right.
Yes. And maybe just to come to you, Patrick, for you, this was something maybe that was strange before. I want to hear your story about how it began and whether you knew that was dyslexia, or how did your story with your son begin? Yeah,
I think the challenge is usually picked up from schools. So schools are a major partner in this process. When a teacher tells you that your child is struggling with reading, the first thing is to ask, okay, but he seems to really be okay in school. There's never been an issue. But so what I noticed is over time, you would give him a set of words. For example, we write the word Wednesday, and you tell him, I want you to write this word 3-4 times. First, you can see the reading is a challenge, and then when it comes to also writing, the spelling is very clear, and you tell him, write this 3 times. Out of 5 chances, he will write maybe only 2 times correctly. So you're like, okay, but the word is there. So you can see the reading is an issue. So it then translates to the writing. That's why there'll be a lot of misspellings. And so you just have to help the child. So the school certainly was the one that brought that issue to our attention.
From
school, yes,
not at home.
Not at home. Yeah, because now this is kindergarten. So at the kindergarten level is when words would be sent home, or some homework is sent home for reading plus writing. So you're like, okay, I think there's an issue here. I think the issue is you don't know what it is, because you'd assume, if you observe it for maybe 6 months and you say, for sure, there is an issue. Yeah, so that's the way the journey was. Yes.
All right. I know that dyslexia is not the only learning disability. Maybe just to run us through the subtypes. I know we are not talking about the others, but just to run us through the subtypes, because there could be a parent who has a child who has that particular challenge, and they are wondering, it's not falling in the reading category, but I am sensing something about my son, how they are writing, mathematics and all that. Just talk to us about the subtypes.
Okay.
We may not focus on those today, but just for awareness purposes.
Yes. Yeah, so as I've said, we have specific learning disabilities, dyslexia being one of them. We also have dyscalculia, which is a problem with maths. So number information or the mathematics operations. We also have dysgraphia. Dysgraphia also is a learning disability that affects the writing, and not just the handwriting, even just putting ideas and thoughts and opinions in writing, or how one shapes letters. There's a tendency to reverse, or even the orientation. So like now, we just had a conversation before we came here with one of the guests telling us that he would write from the right side, going to the left. So that's a form of dysgraphia. And we also have processing issues, what we call auditory processing issue. And that has to do with understanding spoken information, like instructions. And this has nothing to do with hearing loss or other conditions like autism or inattentiveness brought by ADHD. It's basically just a learning, a processing, a brain-based processing issue. So we also have what we call speech and language disorder. That's also a learning disability because it adversely impedes learning. We also have visual processing disorder. Again, it has nothing to do with sight or vision loss. It's what the brain is picking from the sensory input that comes from the sight. So if the brain is not able to process what one is saying, that also affects learning issues. So basically, we have around 7 subtypes of learning disabilities, and it's also important for our viewers to know that we've said that learning disabilities are brain-based issues. So we say they are neurological. It has to do with the makeup and the function of the brain. However, they do not affect intelligence. And there's a very big difference between learning disabilities and intellectual disabilities. And that's why we have very brilliant people with dyslexia, people like Richard Branson, because they have
Anderson Cooper?
Yes, Anderson Cooper. And we have quite a number, even in this country, who are doing great things. So it's also good to give that distinction. Yeah.
All right. And it's good that you've even taken us to that optimistic note, because we were going to talk about the dyslexia affects success in life. And, that is something that we should also discuss. But I want to hear, the very start of it, because you will tell us a bit about how it presents. But for you, you were beginning to scratch the surface, Patrick, in terms of just telling us what was happening to your son then. What did the school tell you? How did they break down this information, and what were they advising you to do, the what next, so that we see how that journey began once you realized there was something off about how he was responding to reading?
To be fair, I think the school usually would follow a protocol in terms of how they want to introduce reading. And they would then, during your meetings regularly per term, give you a brief. So I didn't get the sense that initially they were diagnosing any condition. It was just an update of the child's learning journey and saying, well, while at this age we are hoping that this child should be able to read this type of 2-letter, 3-letter, and this type of sentences. So at that point, it's not very clear whether there's a condition. It's just maybe the child is just taking a little bit longer to understand, but there is no issue. It's only from my own research that I started saying, okay, as parents, we got very, very involved in terms of helping, collecting homework, talking to the school, really understanding why is this child who is otherwise at home very, very brilliant, extremely self-driven, extremely articulate. He's a type of child you do not need to worry about anything about life. Why are they struggling with, quote, this small problem? So when, through research and discussion is when I discovered, okay, maybe there is a condition because you can clearly see the letters are sort of floating and moving away from where they should be. So if you're saying the word cat, maybe the letter T comes in between, into the middle, in their mind.
In their mind, that's what they say.
Yes, that's what they say. So the question, so it was very much as a parent wondering, trying to reconcile two things. Why would this issue of reading be a challenge, but otherwise you're fairly okay? From 2.5, you can cook, you can clean, you can talk. So it raises a couple of things. One, so you look back as a parent, you say, okay, was this child, when they were born, did they have a problem? And sometimes, just from research, I think that's the way we picked it up.
So what I'm picking from your story is that you took initiative.
You must. You
took initiative and you got involved. Not like the other parents would say that school is bad, that teacher does not know how to teach, they're discriminating
Don't shoot the messenger.
Child. You transfer your child from one school to another, just trying to prove a point, So you got so involved and even went ahead to research and find out what could be the issue. And
Safina's, the other thing, and I'm not sure Elsie, but Elsie knows, we do have a school actually ourselves. And we work with children with learning disabilities. And I think sometimes the schools have a major role of also, to be fairly honest, schools are not development assessment centers. They're educational centers. But they can observe. They are with this child for a very fair, large amount of time. They can observe, and I think they need to have the courage to tell the parent, we notice this and this is happening. Perhaps you could consider. I think that was the link that necessarily didn't happen, because then that time you say, okay, let's give it more time as it manifests. But if you're told early, we talk about early interventions. If a teacher who's done a bit of work for a long time can observe, because they have a large population, they can tell you, you may consider going for an assessment, going to SC for an assessment. And that would have helped as well. At that time, yes.
But it also depends on how this information
is broken down.
You may think this teacher is trying to say your child is not intelligent.
Absolutely.
So it depends on how the approach.
Sensitively.
Even the teachers should be sensitive how they are breaking this information down to their parents. But coming to you, Esther, how common is having taken us through the different learning disorders, how common is dyslexia, and how does it present, even if you just borrow from the signs that Patrick was mentioning what they saw, just broaden it a little bit. How does it present for maybe caregivers and parents who are watching?
All right. Yes, so dyslexia is quite prevalent. Actually, we talk of 1 in 5.
1 in 5?
1 in 5. In this studio, we are 5 of us. So there could be a chance one of us.
Okay.
Yes, so 1 in 5.
Close.
Yeah, 1 in 5. And actually, this one in 5, they talk of that being in the developed countries. So in developing countries, they say the prevalence could even be higher. But we are looking at 20% of the population being dyslexic. That's a very high prevalence. In the US, they say 40 million. 40 million people in the US are dyslexic. Sadly, we have no data here. We have no statistics of how many.
So there's no number to put.
We have no number to put.
And the lack of diagnosis.
And the lack of diagnosis.
So many people who don't even know.
Absolutely. We have so many people who are dyslexics who are walking undiagnosed, and you can imagine they were never. So lack of diagnosis or assessment means they were never supported. So we have so much talent that is being wasted because we've said these are brilliant guys. So if we are able to know why they are not achieving as per expectations academically, and maybe harness the other gifts that come with dyslexia, that would help a great deal. So coming back to how it presents. So we've said this is a brain-based condition. Neurological, it's got to do with the brain, how the brain is made up and how it functions. And it's, as we've said, it's a school problem. It's an education problem. And to a layman, we actually say dyslexia is a reading disability. But we know that reading is just one component of literacy skills. So we have reading, we have writing, we have spelling, we have comprehension, and even spoken language, sometimes the oral language. And all those skills are intertwined. So if you can't read, then you will struggle with spelling, you'll struggle with writing, you definitely struggle with comprehension. So how dyslexia presents itself in the formative stages when a child joins preschool, just like Patrick has said, we all know in preschool, that's when they are learning the sounds, or what we call the phonics. And that's where reading all starts. So the sounds are the building blocks of words. So you have to learn the sounds to be able to learn the words. And I'm happy that we have picked that model of teaching reading or literacy, because in our times, Safin, we were never taught that. It was the letters, the ABC. Sounds are very recent. But that's what we are calling the structured literacy of teaching how to read. So what happens with a dyslexic brain, the brain has challenges processing those sounds, because we have what we call the letters, then you map those letters into the sounds that they make. So that A is A, B is B, C is K. So the brain has a challenge processing that. We call it a glitch. And so if the child is not able to see those letters, which are just patterns and symbols, and it's a code, and decode those letters into sounds that the child is going to use to read words, that's where the breakdown is. And that's why you'll find that there's even reversals of letters, because again, there's the mirror image. Some will see the D as the B. So when you see that confusion of D and B, and it's very common for young, yes, P and yes, or Q and 9. So even with numbers, you will find they are also reversing, the 7 being written on the other side, 3, 5, and but it's very common with young children. But when we say if it persists beyond grade 1, grade 2, then that's a red flag.
Because I was about to ask, how do you tell the difference between that being an issue and just the normal child developmental stage?
Yes.
You know, when they're still learning, they would write the 5 the other way.
Absolutely.
7. How do you know that, hey, this one there's an issue? But in this case, this child just needs some time, they will catch up.
Absolutely. So beyond grade 1, grade 2, there's just like even the young children are not able to tell, because that's a directionality issue, the left telling left from right. So when they flip the numbers, in the letters D and B, it's because the brain has an issue to tell the left and the right, because one faces the left, the other one faces. Just like the young children, even when they are wearing their shoes, you see at a very young age, they are not able to tell the left and right, but with time, they are able to tell. So, but if that persists, again, that's a problem. So the telltale signs at that foundational stage is the reversal of letters, the B and the D. If the child has challenges, of course, recognizing and identifying the sounds. If they have challenges, blending, that is joining those sounds to read even the small letter words, what we call the 3-letter words, or the CVC words, the consonant vowel words. Then if, again, even writing those sounds or numbers is a problem, including even sequencing, because they may have the numbers or the letters, but they're not sequencing them well. So that's already a challenge. By the time they are finishing kindergarten, preschool, most of those children have some reading proficiency. The 3-letter words, the 4-letter words. They can actually write even simple sentences. They have comprehension, even if it's very simple sentences. So if all that is lacking by the time a child is transitioning to grade 1, then that's a telltale sign. But again, there's a lot of confusion because, as we've said, the child in other areas, they're very brilliant, socially very good.
Yeah.
They have even leadership skills. They are able to do much, but when it comes to writing and reading, that's where there's a problem. And what
Patrick calls these small issues.
Yes, the small issues, and that actually the teachers, yes, they can do the big stuff, but what looks like so minute is such a problem. But again, now the challenge is that what I've seen is that teachers will have a tendency of adopting a wait and fail approach. Until now it becomes a big deal, that's when they flag it. So parents will be told, it's okay, it's just a lag.
Give them time.
Give them time. And by the time now it's becoming a real issue, because when they get to third grade, transitioning to grade 4, and remember, it's much easier kindergarten, grade 1 to 3, because sometimes they are only dealing with one teacher who's handling all the subjects. They get to grade 4, now multiple teachers, different, each subject.
With different characters.
Different characters. Again, the rigors of the curriculum, it's advancing, it's becoming a bit more complex. The child has all these gaps to bridge, and that's when now the real issue, that's when the rubber hits the road. And that's when we start now seeing them for assessment. But this period of grade 1 to grade 3, as Patrick has said, if maybe at that point those red flags are taken seriously and the child is brought for assessment, we can do a lot of interventions, and I know we'll talk about interventions later.
And that's if they make it to the assessment stage.
If they make it,
you can imagine the damage that you would have done even to this child mentally.
Absolutely.
Because children are very sensitive. When you see your peers are able to do something and you cannot, you even begin daring doing homework, you begin daring, you fear even reading aloud because you will be embarrassed. Kids will laugh at you. So you can imagine the brain damage that the mental health of that child by the time they're getting to grade 4 and they're not able to do the basic things that their peers are able to do. So
absolutely.
Yeah, the earlier the better. I want to know the next step you took, Patrick, because it goes beyond just knowing, okay, something is wrong. So what did you do? And how did you find out that that was the best approach to it?
I think the main thing was try and look for help in reading. So we have an older son, so I went and looked for the teacher, because it's a school issue. So you look for a teacher who had worked with an older child and it had worked. So and just try and catch up with the delay in terms of reading. And it's unfortunate, but that's what we did. So every Saturday we would have a teacher, and the instruction was very...
The older child had a similar issue?
No, had no issue. So we went looked for a teacher who had taught the older one to say, if you did a good job before, maybe you may try and help. So the plan was come every Saturday, spend at least maximum 30 minutes with this child, because he's a fairly young child. Do 15 minutes of math and do 15 minutes of English. That lesson would last for 3 hours. Same child would write, would work through. So quickly, the lessons we could see was one, so get some help from someone, so that at least you understand the child better. At that point, the issue of assessment had not kicked in, because he seemed to demonstrate some capability. Secondly, we learned he's not an auditory learner. Don't tell me all the time. Let me do. If you let me do, so if you're counting, you're writing for me, you want me to write number 1 to 5, can we have 5 things? So that then I can correlate tactile, and then I can say, okay, then I can transcribe. See, you want me to write, then I can transcribe. So a lot more attention was necessary, but there were very many reflective moments. One, the children are very highly intuitive. He would ask, why on Saturday am I having this class, yet this other one is out playing? That's so you can tell there's a very high sense of cognitive skills, and you'd have to explain and say some story. And remember, as a parent, you're not trained. Then the other thing is just give the process time. So I think that's just let this intervention that you have gotten for getting a teacher, just give it time, and that really worked. I think there were other issues around self-esteem, because however young they are,
they know,
they know I am being treated differently.
Yeah.
And you know, there are also escapades. I think other issues of how to how do I say? I think with good intent, but sometimes it doesn't come out. I think schools and even parents can do a very good way of covering a child, so they don't necessarily have a lot of feel that in school and at home I am different. You know, you're just one of us. And I think one of the other things we did also is not to be the teachers as parents. Yes, let us be the people that our children come to decompress the hard things of life and school. At home, I can't then be the one to teach, because then there's no place of refuge. So we took it that way, and it's really helped. And he's now in year 7 in junior secondary. But you'd still see up to now those challenges are there, in English especially. Yes, in English especially.
All right, so just so we understand the best approach and the next steps to take, sorry, I'll take you back a bit on what causes it, because I've heard of cases where you find a parent had dyslexia, a child has. So is it like, talk to us about the causes, the risk factors, and you can now take us to where now we get to the point where the diagnosis, like how do you now move it from, you know, feeling funny as a parent and now knowing that there is actually a problem that has been confirmed by a certified specialist. So let's begin the journey of helping this child. Because that brings the whole difference.
All right. So for the cause, we really have no known cause for some of these neurological conditions, but what we attribute to be maybe causes is what we call risk factors. And we have several risk factors. And for dyslexia, and especially what we call the primary dyslexia, which is developmental, like you're born with it, is genetics, so hereditary. And dyslexia is highly hereditary. And we have a higher prevalence of boys picking it from the father, with all due respect, but that's research.
Science.
It's science, yes. Yeah, science. Yeah, so I have so many children who have been brought to me for assessment, and upon diagnosis, that's when now the parents actually pick their own diagnosis, and they're like,
so they even didn't know.
They did know. Yeah, they did know. Yes, because you know, those days the assessments and diagnosis they were not there. But now with the children, so many parents have diagnosed themselves through their kids. But of course they will see these were similar struggles that I struggled with. So genetics, there's a whole a gene that is attributed to that, and research is still going on to be able to really pick the specific genes. Yeah, so we also have other risk factors, but mostly you will hear probably maybe if the mother, while pregnant, may have been exposed to some, toxic substances like lead. There are also speculations about mercury, but mostly lead. So that, again, has been attributed to learning issues. We have other conditions where the parental age, and especially the maternal age, advanced maternal age, has been contributed to these issues. But for dyslexia, and especially
like if you have a baby way late into
yes. So they talk of the maternal age, they talk of 35 as a risk factor, 35 and above as a risk factor. The fathers are a bit fortunate, them is 45 and above. Yes.
So this thing, the earlier the better.
The earlier the better. Mapema ndio best. Yeah, so there are those risk factors. There are also other risk factors, maybe a bit delicate topic to get into, but they have also been risk factors attributed to substance abuse, but mostly not in dyslexia, but other conditions, because we have a condition like what we call the the fetal alcohol syndrome, and those kids will still present with learning disabilities. Yeah, but for dyslexia, the primary dyslexia, we also have acquired dyslexia, where maybe later in life there's a brain trauma, brain injury, and a person may present with learning issues, loss of skills that had already been attained.
They had before.
Yes, but the common dyslexia is the primary dyslexia that is highly genetic. Yeah.
So this diagnosis, how is it done, and who does it? And you know, it's not like the common blood test that you go to the hospital.
No.
So how do you do it? And is it done at the home or in school, or like how do you get a proper diagnosis, and how is it done?
Okay, that's very good question, Safina, and I think we need to demystify assessment, because when we talk of assessment and diagnosis, it brings a lot of fear to parents, and I've seen most parents shying away from bringing their children for assessment. I think, of course, because they feel it may end up with a label. But we keep saying, if we can't place a finger to what we are dealing with, it becomes very hard to manage it.
Yeah.
So it's very important that if you suspect your child is struggling, just bring them for the assessment. So assessment is simply testing. So we have different types of assessment. We have what we call screening. This is just basic testing to check the reading proficiency, the writing proficiency, spelling, and comprehension. Then we have what we call the psychometric assessments. Those ones are diagnostic assessment. I am a psychometric assessor. So we use what we call assessment tools. Tools are basically tests. So we have what we call standardized tools, or norm-referenced tests. And these are tests that have been standardized or moderated in a way that when you test a child, the results will compare with other children of the same age. So for instance, for dyslexia, we even have a very recent test that has been published. These are global tests. So we have a current test we're calling the test of dyslexia. It's the latest, and it's a comprehensive test that has 24 subtests. And so from those subtests, it will test reading, both what we call oral reading, because we are saying dyslexia affects the reading skills. So it affects so we have a reading test, we have spelling tests, we have comprehension tests, we have the phonics. You remember I talked about the sounds. It also tests what we call phonological awareness test, because that's where it all starts. We also have tests that subtests that test the reasoning, because we also want to see, to test the reasoning abilities of this child. So we have a test that will also test that. So all those tests, once you administer them, and you don't have to administer all the tests, so you can pick depending on the history, because what happens in an assessment process, the first thing is first to pick the history. So when a child or a client is brought to you with a history of learning challenges, so you first pick the background information. And this information comes from the parents, and from the parents you pick right from the birth history.
How they have
from the pregnancy, actually.
Ah, okay.
Yes, because you want to see, remember we talked about risk factors.
Yes, yes.
So you want to find, could there have been factors that may have predisposed this child, including even sometimes sicknesses and illnesses, although we say dyslexia is not a medical condition. So you pick the history from the parents, birth and developmental, the social history, then you also pick history from the school. So you gather a lot of information on how the child has been progressing. Then from there now you're able to correlate your findings with what the history that you have picked once you assess. So after we have picked the history, now we go into the actual assessment, the testing. You had asked whether it's done at home or in school. So ideally, there's really no specific place that you can, so long as you're in a room that is conducive for now the actual testing that has no distraction, because those are also also other dynamics that would affect the performance of the assessment. But like in my case, I have an office where the clients come.
They come with
yes, but I also work very closely with school. As you said in my introduction, that I'm an also inclusive education consultant. So I get a lot of referral cases from the schools. So sometimes it's easier to do those assessments in a familiar environment.
Yes.
I've had cases where children are brought to me for assessment, and it looks like they feel like it's a hospital. And they have come to see a doctor. And the fact that most people call us even doctors.
Yes.
So probably the child may have overheard mzazi akisema we are going to daktari. Yes, but from the school setting, so long as you're given a room that is quiet, that is very conducive, I have seen it work very, very well. There are instances I've had to do that assessment from home, from homes. So we are given a private room, and we do that assessment. Yeah, so then once you administer the tests, as I've said, they are standardized tests. So you pick the raw scores. So for instance, if it was a reading sub-test, and it had 30 questions, so, and the child scores 10 out of 30, 10 is a raw score. So that 10 means nothing, Safin. So we've got to interpret it into scores that will give us an impression or a conclusion. So we convert that raw score into other scores. It's a bit of statistics. Into other scores we call scale scores or standardized scores or percentile scores, so that we are able to compare how that child is performing in relation to his peers, to other children of his age. And that we are able to tell, is the child at par, are they below, or are they above? Because interesting enough, dyslexics have a very interesting profile. They have what we call a spiky profile. So you'll find out of, for instance, if I administer the test of dyslexia assessment, and maybe I pick like 15 subtests, so you will find that there are some tests the child is actually above, even superior, above average. Others may just be moderate. Others are, of course, those with reading, spelling, you'll find they are below average. But those with reasoning, and like the reasoning tests are very abstract. We give them what we call geometric shapes, pictures, and they're supposed to reason and know what's the pattern, what's going to be the next. So they're very good in those subtests. But tests of reading, spelling, writing, I can tell you, so they have a very spiky profile. Then once we are able to consolidate all those the results, now we are able to make a conclusion that indeed the child is at risk for dyslexia. And again, we are even able to give it a range, because dyslexia is a spectrum, what we call a continuum, from mild, moderate, severe, and profound. And you are able to give the range.
And now you can be able to now recommend what sort of intervention is.
Absolutely. Yes.
Wow. Now, having had all that she has, shared, I don't know whether you relate with anything in terms of just putting it in context in your own situation, from even trying to imagine where it could come from to, did you ever take your son to assessment, and what was the experience? Yeah, and what did you do as parents?
So in terms of sort of a formative assessment, we've never taken him for a formative assessment. I think this knowledge and benefit is quite recent in terms of established places. He's about 12 years. So I think the concern initially was when he was a lot younger, at 6 years, which is about 7 years ago. But yeah, I don't think the rule is to completely rule it out. In fact, that's how we were linked up with Essie. There is necessary need, because when they are now, the challenge in fact is, as he's going up in the higher levels, he has no problem with abstract thinking. It's very, very in terms of...
He's getting better?
He's very good, yeah. So, but on the reading, typically the way schools are structured, proper writing of words is what gives you the grade. If you keep consistently misspelling, however well and articulate you are in the... if I give you the oral test, you're quite articulate, your marks will usually be And that's something just structural,
Yeah.
you know. So sometimes I do think that schools should also give sort of just like an oral score, that you're able to articulate a point and modulate that a bit to say, you know, but I think those are sort of the policy issues that need to be explored.
Get there. Now we are on CBC, the reform journey. I don't know.
Yeah. So
we'll get there someday.
The bigger point I think for us is, and this is something that I spend a bit of time trying to think through, are exactly what this child could be in life. Forget about schooling now. You're casting your eye into amemaliza shule. What careers, for example, would the child go into? You know, and I think that's where I think I've been spending a bit of time saying that we do need to do some assessment to see, okay, school-wise he's okay. He's in a good top percentile, so you're not too worried about his schooling. But exactly how is going to be his life outcomes later, when he's mature and he's out of control. And that's actually a better discussion that we are trying to explore, so that then you don't, like our parents, shove somebody to a career or to a direction that they have no association or interest.
Or you group your children. Kuna wale wazazi waliamua, these ones are not performers, let's not focus so much on them. But huyu wa A, huyu ndiye anaweza atoa iboma nje. So they focus on that one and forget these other ones. And it could be that maybe it's just a challenge that can be managed.
Yeah, and to be honest, even for us, we've never, even when he was very young, we would make sure that when he goes to the next class, we would always have the meeting within the first 2 weeks of changing the class to go and explain to the teacher, don't raise your standards too much. This one, let him enjoy life, because we also don't know what's going on. And I think that was a coping mechanism, but it really helped. So you almost then, as a parent, let the child thrive as long as we've learned smaller classes work. Do not, for us, a class of 7, 10 works very well. When you do 20, 25, that child will get lost.
They disappear.
However well-intended the school is. So those are the lessons. And I think ultimately now there's a lot more tools, psychometric tests. But I think the focus for us has been more towards where will you go? So that then we put you on that path now.
There was something you mentioned about, you know, his concern. He's asking why other kids are playing and he's the one doing learning on Saturday. Talk to me about his mental health and how this impacted him, and what sort of support did you give him as parents?
I think the thing is, I think when you're planning those interventions of getting extra help, you're not quite sure, you're not quite thinking through that is actually one of the unintended consequences. You're trying to sort this issue of reading, but you're creating a second issue of mental health. And self-esteem. And self-esteem, definite self-doubt. So the idea was usually to reassure him that everybody is on his side. The teachers, the parents, the community, everybody is on his side. And continue to express that reward, and also reward him for every effort. And that you could see, you know, after 2 hours, the teacher would also reward him. As a parent, you'd recognize that. The other thing was also not to overwhelm him. It cannot be that you're spending hours on end per week with a child who is barely 6. You know, they'll be in school for a very long time. So I think the panic, on our side, there wasn't panic, but there was very small effort to try and say, let's see what we can do and keep learning and relearning, learning and relearning. I think the challenge is not a lot of schools will tell you, or you find a sign somewhere saying we assess dyslexia. It's not there.
It's not there.
It's not there. And now your hopes and your hopes are really pinned on a teacher. So you want to hold on to that teacher very closely so that they can be giving you observations. And then, you know, it is actually a very confusing space. And you do find a child like that also, especially when they have a sibling or siblings, there is a lot of tension, even at that age of 6 and 7,
so the
of fighting.
Not just even in school.
No, even in the house.
At home.
Yes, you know. So he will, you know, and he'll ask you, so you could see he will not take instruction from the older one, you know. So there's just tension. You keep seeing in the house small fights and things like that. And you'd say, oh, this is sibling rivalry. Sometimes it's not. It's basically a child is processing in their mind, why am I looking like I have a challenge?
Yeah.
And I think those are the dynamics you have to keep reassuring and bringing everybody on board. I think also for parents, I think there was a big challenge around feeling that your child has an issue. That was
even you're accepting it yourself.
For me, I think it was more the issue of, what is the issue? Let's get on board. Let's give me the tools, all of them, throw at me. Whereas I think generally some parents also would be like totally frozen at the fact that your child has been labeled, as you said. And those, they can be very incapacitating. So you do need a bit of professional help sometimes, or even a lot of self-assurance to say, okay, this is actually a chance that I can work through this process.
So even parents need counseling.
Oh yes, they
this
do.
thing of saying me nilikuwa number 1 kwa class. So
doesn't apply.
You have to be like us.
Absolutely.
Anyway, so take us back to the intervention. So now you've already even graded, for lack of a better term, the level of dyslexia, from mild to severe. So is it doom and gloom, or there are options? We have parents and caregivers who have such children in their homes, and they're really struggling. How will I bring up this child for them to be successful in life? Because in Kenya, education is like everything.
Absolutely.
Yeah? So are there interventions? What do parents do?
Okay. Yes, so it's not doom and gloom. It's not a death sentence. And we keep saying dyslexia is actually what we call a paradox, that there's this island of weaknesses surrounded by a sea of strengths. Because the beauty is, as we said, it's not an intellectual disability, it's not an intelligence issue, and they have a lot of giftings that they have if they are well nurtured. But maybe going back a little bit to Patrick, is that I would say Patrick is one of the cases, one of the few isolated cases where maybe as parents they took it in their strides, and probably they were lucky enough to have some form of support from the school, even if maybe not really what would be the ideal. But I think the real situation out there, Safin, is that we have parents who, first of all, don't really seem to maybe have the resources or the capacity to be able to do what Patrick did. So, and in terms of maybe just the denial, and they are not able to come out and maybe confront the issues. And then again, when it comes to the schools, he seems to have been very lucky. Most schools, if a child is not achieving the benchmarks, the next thing is that you're called and you're told your child is bringing down our mean grade, and therefore we are not able to support. If not that, maybe the environment is so hostile that this child cannot cope in such a learning environment. And it's very sad that we have children in grade 1, grade 2, grade 3 coming to us, and they have been like into 10 schools. School is
either because the parent is trying to get the perfect teacher,
absolutely,
or the environment is just not inviting.
Yes, or the school feels this child does not fit here. So, and that should not be the case. And now coming to interventions, once we have the diagnosis, once we have done the assessment, we have a raft of interventions that can help this child. And the interventions are, again, of course, need-based, because dyslexia presents differently for different people. Apparently, not everybody with dyslexia has a reading issue. There are those that will read, even very fluently, but comprehension is a problem. There are those that will read, but writing and spelling is where the problem is. So depending on what the assessment results will reveal, we are able to recommend interventions that are individual based. But just the basic or the common interventions for people with dyslexia is, of course, we talk of once, if the issue is reading, then we've got to intervene on reading. And it all goes back to the phonics, the sounds. We've got to start there. And we propose something we call a multisensory approach to reading. He talked of his son not being an auditory learner. And what happens in our system, our education system, maybe before, and especially with the 844, was very talk and chalk. and so the teacher
you can't hear,
yes,
can't understand,
absolutely,
can't comprehend,
yes,
you're out of
the system. But for kids with learning issues, one sensory modality of learning does not work, like the hearing. So we talk of multisensory, use different sensories. So the visuals, so whatever it is, if it's those sounds, use the flashcards. Now we have technology, assistive technology. Use the videos, the YouTube, so that the child is seeing what you're teaching, they are hearing it, they are touching it, they are manipulating it, and they are applying it. There's even the tactile, they are touching. So all those sensories employed while teaching really help. So that is one thing. Number two, and I think that should even be the number one, is that you have to individualize the learning of this child. So we have a document we call an IEP for a child with special educational needs, individualized education plan, based on the challenges that you have seen, and even the strengths. It can't be a one-size-fits-all, Safin. So when
every child has unique challenges, need unique
yes, and that is where now the challenge is, because he talked of the small classes, and that's where now it is achievable if the class is small. Because imagine a teacher, we've said 1 in 5. So if you have 20 in a class, probably 4 could be dyslexic. So, and we are talking of highly individualizing the interventions. So the challenge that teachers will tell me, Esther, how do I achieve that? I have 40 and 30 kids in a class with 30 or 40 minutes lesson. How do I achieve that?
The capacity.
The capacity, So as much as we talk of the individualization, the capacity issue sometimes affects that. And that's where we tell the parents, then you've got to go the extra mile, that if the school is not able to do that, then get a remedial program, or the school to do a remedial program.
Sorry to cut you short, Esther. This was quite informative, But I like the fact that we have ended it on a note where there's a way forward. Just 30 seconds for your parting shots. Let me start with you, Patrick, as we close the program.
I think my advice is just get involved. Be curious as a parent. And I think appreciate the upside to this particular challenge, and your child will see that you are quite invested, and it eventually works out.
Esther?
My parting shot is to teachers that if you realize that a child is not performing as per the expectations, please bring it up with the parent. Let's flag those issues early enough so that they can lead to early interventions, which is very, very key.
All right. Thank you so much, Esther. Esther Wamai is an inclusive education expert, and also she's a dyslexia consultant. And of course, we've also been engaging Patrick Munoru. He's a parent, has told us a lot about his experience having a son who has dyslexia, and just what role they played as parents to support him. A good thing is that he's getting better, and the interventions are working. So it's possible. And yes, you can Google. There are quite a number of people who are successful. Very big names out there. They are successful, doing well, beautiful stories, and they also, went through this particular learning challenge. So it's possible. Don't give up on your child. Just walk with them that journey, and you will be surprised who they will turn out to be in the future. Of course, you can reach out to those who can offer you support, and things will just get better for you. My name is Safina Chengoma. We really appreciate your time and company. Let's do this again next week. If you have anything that you want us to talk about, I'll bring in an expert, somebody who has lived through the experience here, and will be able to make it easier for you to understand. And this is what we do each and every Wednesday. In the meantime, have a lovely day ahead and enjoy the rest of your viewing.